Good afternoon, everyone. Thank you for joining us here at the National Health Insurance Authority for our monthly beneficiary educational session. We are in the month of February, and throughout the world, this is observed as Heart Health Month. And coincidentally, it's also considered the month of love. And so we just want to take a minute to introduce you to our agenda for this afternoon and to speak to who we are here at the National Health Insurance Bahamas. Who are we? Our vision statement at the National Health Insurance Authority is we are leading the way in providing access to affordable quality healthcare that Bahamians deserve. Our mission statement speaks to the fact that we are transforming the healthcare system upon which the future well being of Bahamians depend by putting patients at the center of every decision that we make. At the National Health Insurance Authority, we are passionate about bringing universal healthcare coverage to all Bahamians. We are relentless in expanding access to quality healthcare through progressive solutions supported by technology. We are dedicated to delivering affordable healthcare through partnerships. We are committed to doing business with integrity, accountability, transparency and sincerity. And we honor our beneficiaries by providing care and respect in all aspects of our service. And so, as a part of our NHI Bahamas Wellness Program, we focus on three tenets, and we encourage our beneficiaries and the public at large to adopt these tenets. The first one is to incorporate exercise and physical activity into their daily routine, to understand that your food should be your medicine, and to focus on your mental, emotional, and spiritual health. Ultimately, this will lead to the enhancement of the overall health and well being of our nation. And so, where are we now in the National Health Insurance Bahamas program? Since our inception in 2007, we have worked very hard and diligently in delivering on this vision and advancing the path to universal healthcare coverage. And so our enrollment growth, we can boast that over 160,000 plus Bahamian citizens and legal residents have enrolled in the program. Our, our demographics is very diverse. We currently enroll Bahamians and legal residents from more than 17 islands. Um, and the breakdown includes 7,000 plus Bahamians under the age of 5 and more than 30,000 school age children, which make up our pediatric population. And over 20,000 plus Bahamians and legal residents over the age of 65 are currently enrolled in our NHI Bahamas program. 96% of our beneficiaries have informed us that they are satisfied with the services that they are receiving in the program. Our provider network is expansive, and we're currently in partnership with over 139 physicians across 88 primary care facilities on 8 islands. We're also in partnership with 14 major labs spread across 21 locations. Additionally, our digitally enabled care affords our beneficiaries to have access to their medical records in an electronic health record platform, where the telehealth feature is enabled for applicable visits. According to data from the American Red Cross Society and the American Heart Association, approximately 90% of people who experience an out of hospital cardiac arrest do not survive. Over 70% of out of hospital cardiac arrests occur at home. Immediate CPR can double or even triple a person's chance of survival. Using an automatic external defibrillator, also known as an AED, within 2 minutes of collapse can result in a survival rate as high as 70%. Based on response time, survival chances decrease by 10% every minute that CPR and the use of an AED are delayed. The American Red Cross trains more than 3 million people per year in first aid, CPR, and AED skills. In international regions, the Red Cross has trained over 60,000 persons annually in life saving skills. This afternoon, we are happy to welcome Ms. Norma Roberts. She is a certified Red Cross instructor since 2014, specializing in first aid, CPR, and AED training for banks, schools, healthcare trainees, electricians, and food service businesses. She has trained numerous organizations to recognize the importance of life saving skills and preventative measures and is passionate about equipping people to help others both in crises and at home. She is a committed church leader and God lover, and she founded a small community group during COVID in 2020, which continues today. Divorced with two adult sons whom she adores, she spends her free time with family, in ministry, and visiting friends. And so this afternoon, we find it an honor and a privilege to partner with the Bahamas Red Cross Society, as well as with the instructor, Miss Norma Roberts, to present on the subject matter, how to save a life. All right. Good afternoon, Ms. Roberts. You are on.
Good afternoon, everyone, and thank you. First, I'd like to thank Ms. Chandra Sawyer and the National Health Insurance Authority, NHI, for you gave such a nice introduction, but I'd like to thank you for this opportunity to share. Now, my name is Norma. I have been with, like she said, with the Bahamas Red Cross for 12 years as their first aid CPR AED instructor, even though I have been teaching for 20 years plus. Now, as Ms. Sawyer would have said, as this is the end of February, the heart month, the love month, the objective here is to share some important information that can help create or improve healthier communities and save lives by demonstrating these skills that we could learn through love, compassion, and empathy for others. Now, let me make a disclaimer right now. I am not a doctor. I am not a nurse. I'm not an EMT. But I have been doing this long enough that, God forbid, somebody's heart should stop beating. I know enough to get that heart beating again, get them breathing, and giving them an opportunity to survive. And so, with that said, I will try my best at the end of this session to answer any questions that you may have. So I encourage you to write your questions down, and at the end, we'll be able to take your questions. Now, let me just share some information about the Red Cross. The Red Cross has 191 societies all over the world. And I think that's why one of the reasons we are so recognized. We are a humanitarian organization that provide emergency assistance during disasters, relief, and education, operating under principles. We do not see nationality. We do not see cultures. We do not recognize religious belief. We don't see skin color. We don't see status. All we see is a human being, a person who is hurt, a person who is in need of our help. And so the objective is to alleviate human suffering. Some of our services include food packages, supplying blood donations, supporting military families. We have the Meals on Wheels. We also provide health and safety training, and we offer international health services. And we know, because we've all seen it during the hurricane season, how the International American Red Cross, they come in and they are amazing. We've helped a lot of people, and people are still talking about it now. With all that said, we will indeed accept all donations and volunteers offered. Now that is out of the way, let's talk about how to quickly recognize a life-threatening emergency. Now, first, we have to understand the life-saving chain of survival and know when and how to act safely. Most persons who have done some sort of CPR training would remember the 3 Ps. They come all the way back from initial. And the first of those P is to preserve a life. Let me explain. If somebody is in trouble, if somebody is bleeding severely, if somebody is breathing abnormally, our objective as a lay responder or a first aid responder, because once we do the training, you will get a certificate that is good for 2 years. And so you will then be recognized as a first responder. So the objective is to preserve that person's life. The next P is to prevent the injury from getting worse. So whatever we're going to train you, whatever we're going to teach you, it's skills and it's steps to know what to do to stop that injury from getting worse. And the last P is to remote recovery. By us doing the skills, putting them into place, it will allow that person, help that person in healing, giving them relief from pain and reassuring them while we wait for the professionals, the medical persons, the EMT, the ambulance to reach on the scene. Now, we would have seen a lot of people, and that is why this thing started. A lot of people were getting hurt or bleeding severely or even having heart attacks. And by the time they actually got to the medical facilities, the hospital where the doctors can treat them, they didn't survive. They didn't make it. Because the time between the injury and transporting them to the hospital was too long. And that is why we are giving these training, these health and safety training skills to help the person to survive until we can get them to the professional people to take over. And this is a big thing for me, because here in the Bahamas, people are actually dying because enough people do not have these skills to help these people, to give them a chance to do these, to put these steps into action so that they indeed can survive and have a better life. Can you imagine saving a person's life? That person will thank you forever. So this training that we do here at the Red Cross, this teaching about the CPR, AED, and first aid, it actually helps. It is vital that we get these skills and be able to help each other, because who knows? It is proven, statistics have proven that even though your work might send you to do this training, because some places it is a requirement. Statistics have shown that more than likely, most likely, where you use this will be in your home, at your workplace, in your community, with your loved ones. So even though you get it for work, hey, you need this for the rest of your life. So it's very important. And so to be able to take this class, we have online, you can go online, sign up, and they will tell you the course, the days of the class, and everything that you need to bring. So I encourage everyone to send their employees, send your family members. This is actually very important, and it can save a life, and that life could actually be your family member or even your own. So this is important. Now, I want to go through in the training, there are 3 emergency steps that you take. I have been doing this for years, and right now, if I was to hear a crash, the first thing that is going to tell me, oh my goodness, there's been a crash. Somebody is hurt. So I am a human being, of course. You're going to get that feeling in your stomach. But guess what? In my in my world, Norma, my thing is people. Whatever that is going on in my stomach, that's going to have to wait. What Norma knows is there's been an accident. Someone is possibly hurt, injured seriously. She knows enough. She have enough skills to be able to help that person. So guess what? My heart and my mind is going to kick in, and I am going to go and help that person. So that is how important this skill is. This CPR first aid training is very important. And so the first step, the 3 emergency steps you must take, you must be able to recognize to ensure that you know these steps. Once you know that this accident has happened, you are going to approach the scene. Those 3 steps are check, call, and care. What are you checking for? You are already certified. There's been a car crash. As you approach the scene, your safety is more important also. So you don't want to just put yourself, there's a car accident in the middle of the road, cars is passing up and down. You have to make sure the scene is safe for you first, and then the person who's injured. So you have to check the scene for safety, make sure it's safe. Then you go and check the person. Now, let's just go through this. The person could be laying on the ground. They're not moving. They're not saying anything. Because my scene always is that there's more than one person, right? Somebody's not moving, not saying anything. There's somebody who's conscious and they're bleeding severely. Blood is coming from their leg. And so as the first responder, you are taught to prioritize. Who is the first person that you are going to help? Now, I would ask you, if you were in my class, if you were doing a training, go with me. Is that person, because most likely some people say the one who's not moving, the next person say the one who's bleeding severely because blood is pouring from them. Now, that is too severe situation, but there is still a priority. That person who's bleeding severely, my question would be to you, is he breathing? I said he's sitting down and he's bleeding severely. So that should tell you he is breathing. The person who is laying down, he's not moving, he's not saying anything, is he breathing? Your answer should be, I do not know. And because you don't know, that is the person who is your priority. Because even if you get him breathing, if you take more than 10 minutes and he does survive, the chances are that he will be brain dead. So that would be your first person you need to help first. Once you finish dealing with him, Then you could go and deal with the severely bleeding. But Norma is a very, I could do more than one thing at a time. A lot of people can't. The only thing we're asking you is to do the best that you can. I could be dealing with that person who's not breathing, and I could shout to the bleeder. Ask him to press down on the cut. I'll be there to help him soon. So that is what you do. Deal with the person who isn't breathing first, and then you go and deal with the severely bleeding. Now that you know that that is your priority, once you get on the scene, you don't know you go into the unconscious person. So the next step is, how do you know he's unconscious? How do you know that he's not just been drinking and he's in a drunken stupor and he's just trying to sleep it off? Okay, there's some steps you have to take. You go to him, you tap his shoulder, and you call out to him, sir, are you okay? That is how you get a response from a person who is injured. If he does not respond to you, that should tell you he's unconscious. So what you do then, you identify the first person on the scene. Now, sometimes you are on the scene by yourself, and thank goodness now they have cell phones that before you had to pay to make a 911 call. Now it is free, and it is for that same reason. People were not able to make a call, and so there's a long-lasting space, and people actually die when they don't have to. So if you're by yourself, put your phone on speaker, call 911, and you let them know what's going on. But if there is somebody there, you tell them to call 911 and you identify them specifically, because we like to, once the people start coming, we like to pull out our phones and start recording, which is sad, because I know of people who've learned of their loved ones being in a serious accident, and possibly people put RIP on their picture before they actually know something happened. Nobody wants that kind of information. That's why we need to be more sensitive, because that person could actually be you. So you send that person to call 911, tell them to bring you a first aid kit and bring you an AED. And like Ms. Sawyer would have said, the AED gives a person a higher chance at surviving. So if you have it, and a lot of companies too, we are encouraging them to purchase one, especially if you have a lot of employees, because it does give them a better chance. So that is what you would do. You would check the scene, check the person. Then you will send them to call for help, and you give them instructions. The accident, it is in front of the Red Cross building on JFK. We have 2 people down. You give them that information. We need the first aid kit and the AED. Once you've done that, as the first responder, you've already been trained. I've already given you skills because you have your certificate. So now you know what to do. You check for breathing. You check to see if that person is breathing. How do you check for breathing? You make sure they're on their back. There's a way we would teach you in the class how to turn them over to avoid any spinal injury, neck injury, that sort of thing. So we show you that. We turn them over. And then we look, listen, and feel. What are we looking for? If you look down, if you put your air, if somebody come to you right now and put their mouth to your air, you are going to feel their breath on your air, and you're going to hear them breathing. That is what you're listening and feeling for when you put your air to that person's mouth. Then you're going to turn your head and look at their chest. If somebody's lying on their back and they're breathing, you're going to see the movement of their chest moving up and down, up and down. Now, medically, scientifically, it's proven that you need to do that for at least 10 seconds, because the person could be breathing, but breathing very shallow. So you have to do it, listen for at least 10 seconds. The only way you know you're doing it for 10 seconds, you have to count. And so there is a counting process. 1, 1,000, 2, 1,000, and you count to 10. After you've counted 10,000, because when a person is lying on their back, I call them the breathing pipe, your neck. So the tongue, what happens is the tongue covers the hole. When you breathe, a hole open, a flap lifts up, and it opens and closes as you breathe. When you eat or drink, a different flap opens. And that, when you hear a person say, oh my goodness, you're going down the wrong hole, that is what's happening. So when a person is lying on their back, their tongue is over those holes. The only way you can check for that person if they're breathing, we're going to show you that you do a head tilt chin lift. Once you do that procedure, what you're doing is you're lifting the tongue up off those holes. That way, if the person is breathing, their breathing would be able to come up through those pipes, come to their mouth, and you can hear and feel it on your ear. You do that for 10 seconds. Now, let's say you do it and you do feel and hear breathing. You do see their chest rising. Then the next thing you would do is check their body down to the sides. Is there any bleeding coming from this person? Is there anything broken on this person? Once you've checked and you establish that there is nothing else wrong with him and he's breathing, what we teach you is how to turn them on their side, put them in the recovery position. The recovery position has 3 purposes. It keeps the airway open so that they can breathe. If they are sick and they vomit, the vomit drains out the side of their mouth so they don't choke. And the next reason is it stabilizes them. Okay? So you put them in the recovery position, but I want to share how important this recovery position is. There was a scene where a guest walked in a room and a waiter was in the room setting up the room for a function that night. The guest collapsed right there on the floor. Of course, this entity trained their people, so the waiter was trained in CPR. She collapsed on the floor. She actually had a heart attack and she stopped breathing. So he did CPR on her. He got her breathing, and then he left the room to call someone to let them know what was happening in the room. When they came back, the woman was on her back. She vomited, she choked on the vomit, and she died. Had he turned her on her side, when she vomited, the vomit would have drained down the side of her mouth. The recovery position would have kept her on her side. But people are human beings. And of course, you will be nervous, anxious, adrenaline running, and there are some steps you could forget. It's important to remember that one. But things happen. So the training will reinforce, always put them in the recovery position when you finish treating them. So I would have put the man in the recovery position and then move on to the person who's bleeding severely. And then I will deal with the bleeding. So these are the 3 steps. I would bandage the bleeding, apply pressure, bandage the bleeding, and then just talk to him, and wait until the medical service, the ambulance, come on the scene. And that would have been me taking care of, as a first responder, taking care of someone who was not breathing or who was breathing. And I put him, if he was not breathing, then I would have to go into CPR. Now, CPR. CPR is pressing on somebody's chest, putting your mouth on their mouth, and blowing into their mouth. Of course, we also teach you how to give just compression only, because a lot of people, they come on the scene, somebody's hurt, they're not breathing, they have to do CPR, they're not comfortable putting their mouth on a stranger's mouth. Again, yes, you have to protect yourself. There's not been any statistic yet where somebody doing CPR caught a contagious disease because they didn't have a mask. However, we still want to protect ourselves. We don't want to take a chance. So fine. If you don't have a mask, that's the next thing. If companies are going to send their employees, if you want to learn it, then we at the Red Cross also sells the CPR mask that is on a key ring, which consists of a pair of gloves and a mask that you can use, God forbid, should you ever have to do CPR. So that is one recommendation that we offer to the students when they come in the class, so that they can have it. That is, a fireman have their tools, an EMT have their tools, a doctor have their tools. The tool for a CPR, a first responder, is that same mask and glove on that key ring. So yeah, we suggest and we sell them too. And even if you want to order them for your company, which a lot of banks that we train, they order them and they give them to their employees. But it is very, very important that we give our employees this training. I also want to say something to the doctors. A lot of persons that I've trained over the years, for whatever reason, they do not know anything about a medical bracelet or a chain. So my recommendation to the doctors is, once you have diagnosed a patient with an ailment, advise them, okay, the person is a diabetic. Advise them, most of the pharmacies sell these medical bracelets for $22. $22 is nothing to buy if your family member, your friend, your loved one has an ailment. To put it on them, because on the scene, God forbid something should happen, and a stranger like me come up on the scene and I see them, the first thing I am trained to do is look for a medical bracelet, chain, or whatever. Because if I see that on them and I turn it over and I read it, it will tell me what is wrong with this person, and it will help me to treat them better instead of guessing or trying to go through all these steps, because time is of the essence. I believe in when you know better, you do better. I believe in having, if plan A doesn't work, let's go to plan C. Well, this Norma here, Norma can go down to Z to all the plans. Yeah, they say I'm special and that's fine. But I am going to try one thing. If that didn't work, I'm going to have something else. So I would recommend that people who have ailments, please advise them, buy a medical bracelet. So that is important. I think the doctors need to tell them, to advise them, because they say the doctor don't tell me that I should get it. Okay, now here's the thing. I think we have some of the most brilliant minds in the Bahamas, in the world. It's proof, not just because I'm a Bahamian, but we send our children away to colleges and they excel over these other nations. That tells me we have a lot of smart people. But here's our problem. No offense. We are too comfortable. And because we are too comfortable, we get lax. There are people burning up in houses. An incident on Carmichael Road, 4 people literally burned to death. First of all, when a house is on fire and people is in that house sleeping, the smoke itself is what the smoke does, it immobilizes the people, and so they're not able to move. They could hear things happening around them, but they can't speak and they can't move because they're in like a coma, semi-coma. They could hear. Can you imagine the fire reaching to these people and burning them? They could actually literally hold their hand in front of their face and see their hand burning, and they feel it and they would scream. They would scream. I am a very picturistic person, so I want you to get exactly what I'm saying. They're going to be screaming, but you're not going to hear anything till eventually their hand burn off, because they're not going to feel it once all the nerves are dead. Can you imagine that happening to a person just because they did not have a smoke detector? Again, that only costs $25 in their house. This is prevention, people. And I am really passionate about people being so comfortable. The medical bracelet, that help a person. The smoke detector, the CO2 detector. People dying in the family islands because they inhale that because there's nothing in place. We need to get our act together. I asked my class, okay, I have a class of 15. How many people in here have a first aid kit in their house? 2 hands go up. What is this? That should never be. Every hurricane season, people are advising us, get these things, get your first aid kit, get your battery ready. And yet, that shouldn't be. So we have to be aware. We have to be aware of things. A next thing that is such a passion for me is we've heard it on the news. People being dead in the house for 3 and 4 days. And then they come online and say, let's pray for the family. And I'm kind of like, okay, I need to have a conversation with God because I am not pleased about praying for no family. How could you have a loved one living in the house by themselves or even living in the house by themselves and not check on them? See, this is having something in place. If you know your parents live in the house by themselves, and as we get older, we don't want to lose our independence, and I understand that. But we are the younger ones. We should be smart. Let's put a plan in place. Every day, okay, mommy, I'm calling you to check on you. I'm going to work now. I will call you when I get off. And if we put something in place, these people would not be dead for 3 and 4 days in the house. How? So this is why we have to do better. Put something in place. This is a community, neighbors. I mean, come up with something, but never let anyone be in a house by themselves again and dead. This is crazy. So I really feel passionate about things like that. And even the children. We had the incident with the little boy that drowned in the canal in Freeport. That was sad. We have to watch these children. These children are so busy. In the United States of America, there's a law where if you have a pool, you have to have it fenced around with a lock. We have to do everything possible to protect these little children because they're actually learning. They're learning, and in learning, they're touching things. They're going places. So we have to put something in place to protect them. That's our responsibility as adults, as the community. So that is what this training is all about. And if you remember the incident with C.B. Moss, he was in church. C.B. Moss was in church and he had a heart attack. Dr. Darvel was there in the church also. Now, I'm sure there were other doctors, nurses, first responders even in that church. But you're a human being, and of course, something happens, you're going to freeze. And that's fine. But don't let that freeze be long. This is a life. Catch yourself. You've been trained. You know enough. Check out what is going on. Move in and act. I am sure C.B. Moss is thanking Dr. Darvel up to this day for saving his life because it is because of what he did. Got on that bed, started CPR on him straight to the point where when the ambulance, they showed it on the news, the ambulance took him in with Dr. Darvel being on it. Now, had that been a first responder, once the ambulance reached, my duty would have been finished because I am the basic line. The EMT is next. Then the nurse and the doctors. So it's a process that you go through. But because I was Dr. Darvel, he was a doctor. He knew more than the EMTs. They allow him to stay on the bed and stay in the ambulance doing CPR until they got him to the hospital. And today he's alive. Thank God. So it's things like this that we have to think about. We can't just be too comfortable. We have to do things. Children just choking. We do all of this teaching in the class. I've had a student, she came from Providential to take my class on a Friday, went home Saturday, had a family dinner on Sunday, and her 9-year-old nephew was choking. Of course, everybody panicked. But she had just taken my class. And even though she may not have been perfect, she knew the skill. She had enough skill. She knew the steps enough to know what to do. And she said that food came shooting out of his mouth. And of course, Bahamians, everybody started crying because now the boy's alive and everybody's happy. But had she not been there, what would have happened? People, we need to be more aware. These things, anything can happen. And if you have the skill, at least you know enough to give that person a chance to survive. So it is very important that we take this class, that we purchase the medical bracelet, that we put the smoke detector and the CO2 detector, the carbon monoxide, detector in because they come together now in your house. Even if you rent, like I tell them, buy a sticky and put it on that. But do whatever you can to give you and your family and your community a better chance at, living a healthy life, a safe life. So that is what this is all about. And the good thing is, like I said, I am so happy to know that a lot of people are waking up to this training. Like I said, some of the banks, this is a requirement because they connected internationally. And that's a great thing. I'm so happy. Then we have children, nurseries, people who opening up preschools. They cannot open up the school until they send some of their teachers to do this training. An electrician who wants to get his license, he cannot get it until he do this class. Nurses, when they're going into training, this is one of the classes they need to do first. So this is important and it needs to get out there more because it's actually all about, the heart of the matter is all about saving lives. There's a saying that says you give a man a fish, you feed him for a day. You teach a man how to fish and you feed him for life. Same. I could talk to you all on this computer, on this seminar all day because, like I said, I have a passion for this. But unless you come, sit in the class and you take it and you become certified so that you can actually do it. Yeah. But the video that you watch, the mobile app, once you take the class and you download that mobile app, because everything is not ambulance, you don't have to call the ambulance for a simple cut, a simple burn. And that app, if somebody gets a cut, if somebody's having a heart attack, whatever's happening, you go to that app and you press on that situation. It actually will tell you the steps, guide you through the steps, what to do. So that is another important thing that I advise a lot of my students to download. A lot of people into all these TikTok and all these they don't save lives. So it's the first aid app that save lives. So I encourage you to download that on your phone. Find some space for it and download that on your phone. It's very important. Right. So I just told y'all actually how to save a life. Recognize early recognition, early CPR, early defibrillation, early advanced care. These are things that you have to put in place because once a person gets this early, they have a better chance to survive and get through this illness, this injury, or whatever it is, so that they can have a comfortable life. And like I always say, that life could be someone who you love, one of your family members. That life could even be yours. Can you imagine having a company and you send your people to learn and you yourself, something happened and somebody who went to the class learned something and you're alive today? Oh man, come on. That is so amazing. That's a great thing. So that is a little tad bit of what I do at the Red Cross and yeah, what I teach. Help alleviate human suffering and save a life. I think that's kind of that brings me to the end of what I would have to share with you. If you want more, go online, sign up for the class, and come into my class. You're welcome. Now, we could take some questions now. Hmm.
Hi again, Miss Roberts.
Hi.
Yes, are you still there? Yes.
I
Thank you
am
so
still here.
much.
Yes.
Yes, thank you so much. I did send a message in the chat reminding persons to place their questions in the chat so that we could read them to you during this time, which is the question and answer period.
Thank you.
Yes, we definitely could sense and feel your passion. And I did write down my notes, and I'm hoping that persons will one would remember, two also taking notes, and three I also want to share and remind persons that at the end of our sessions we also post the recording of these beneficiary educational sessions on our YouTube channel, and so it's very important for you to go back and listen to them should you need to, and also share it with a family member or friend whom you think it would be very helpful um, in that relationship. Miss Roberts, I noticed that you also touched on training opportunities that's provided by the Bahamas Red Cross Society. My question to you, as we wait for persons to share any questions that they may have for you in the chat, how often are those training opportunities available to the public?
That is a great question. Well, most of the training through the week, Monday to Thursday, most of them are companies who would have called in and reserved the slot. The only day that we have open to the public, which is likable to change if we have so much people, is the third Saturday in every month. So the third Saturday in every month is the public class that we offer to, yeah, anyone in the public.
Okay,
But if
and
we
is
have
there a cost
companies,
associated
sorry?
with those classes? Is there a cost associated with those classes?
Yeah, presently there is a cost, it's $75 per person, and that
Okay.
includes the training, the certificate also.
Yes, and I know you mentioned that the training is a 2 year lifespan.
The certificate is good for 2 years, but guess what?
Yes.
I want people to understand something. This training actually, when I took this training in the United States of America, it is actually a 5-day course. However, we have companies who that's just not good business sense. No company is going to send their employees to do a training for 5 days. So what has happened? They have compiled it into a 1 8-hour day, and that is why the day is so long because it's 5 days compiled into one. So
All
it
right.
is an 8-hour day that you come in and you get the training.
All right. Thank you so much for that, Miss Roberts.
You're welcome.
Yeah, I often wonder the time frame.
A lot of people, they the minute they come in and I give the housekeeping, they're like, oh my God, 8 hours, right? But they knew before they came in because when they went online and signed up and paid, they were told. So they know. But would you believe did you hear me? I've been doing this for over 20 years. And
Yes.
every class said to me, wow, was it really 8 hours? Because they went and some of them wanted more, some of them wanted more days. And so that's the objective. You're going to get a lot of all this. It's a lot of information. So if you're going to get it, then you have to give it to them in a way where they didn't even realize they got it all, got a certificate, and they're happy. So I'm so
Yeah.
glad that I'm able to at least do that, you know?
Mm-hmm. And I know at the beginning of our session, we played a video, and I know you would have shared that link with me. And so I took some liberty and I looked at the channel. And so there are also a lot of multimedia information now available on YouTube. I saw that the video that we played is also an app. So now you have that training that's now available at your fingertips, especially, for refreshing yourself, especially once you would have completed that course. If it's your
Correct.
first time being exposed to that information, there's now social media and the internet makes things more accessible
Very
to
well.
us. Yes.
Yes.
So thank you for that.
You're welcome.
Yeah. So we haven't received any questions outside
Okay.
of this information here, but I wanted to make sure that that's one of the things that we wanted to promote, the opportunity to inform our listening audience about training opportunities. Like you would have mentioned, all of the scenarios that you would have presented with the home fires, persons falling ill and eventually succumbing to their injuries at home, um, not having that first aid kit at home, not having those preventative measures like the smoke detectors, the carbon dioxide detectors, those medical bracelets. All of those were important pieces of information that we wanted to be relayed to the public this afternoon during the session. And so, Ms. Roberts, we have our Vice President our Director of Human Resources, Facilities, and Wellness on the call in the person of Mrs. C.T. LaFleur. I'll turn over
Yes.
the floor to her today so that she can deliver our vote of thanks before we end the call this afternoon.
Okay, I wanted to say something. If since no one sent in, hi Miss LaFleur, sent in wrote down a question. Is there anyone? Would you be able to open up so that somebody may maybe ask a question?
So we don't have, unfortunately we don't have that feature. We just have
Okay,
the feature where they can type.
okay, all right, or
I'm
type.
also checking our Facebook channel to make sure that no questions were placed on our Facebook page. All right.
Okay.
Also, too, Miss Roberts, if you wanted to share with us your contact information at the Bahamas Red Cross Society, if persons wanted to reach out to you outside, I would welcome you to place that in the chat because I know sometimes if someone is driving, they may not be able to remember it. But if you can place your contact information, whether it's an email or a telephone contact, can you place that in the chat so that persons can reach out to you? Especially those individuals that may be representing organizations. I think it's so important for organizations to come together and host these training opportunities, especially when you're dealing with clients and in the workplace. Like you said, I think I also saw a statistic that I didn't mention that a lot of our cardiac arrests not only happen at home but also in the workplace. And so it's important for us to make sure that we're informed and educated so that we can help our neighbors and also help ourselves should the need arise.
Okay. All I will say is that the Red Cross, you could just go online. You could even call the Red Cross number at 323-7370, and it is the Red Cross that you go through, and then they connect with me.
Okay. All
So
right. Thank you.
you're welcome, Miss LaFleur.
Yes.
You can
Yes.
go. Thank you.
Hello. If I don't know, good afternoon, everyone. And I downloaded the first aid app. You're
I'm
talking,
so
so I'm
proud of
excited.
you. Great stuff.
So I'm excited about this. There's a lot of great information in here. Actually, there was just a lot of great information you shared from the very, very beginning, Miss Roberts, from reminding us, for those of us who may have taken a similar course before related to, the three Ps. I think one of my most important takeaways is don't freeze. I think that's our nature when something happens, versus acting and assisting, don't freeze. But what I really want to say, Miss Roberts, that you said humorously that, your friends and family call you special. I just want to say you are indeed very special for what you do.
Thank you so
This
much.
has to be you know, a passion. And it has to be extremely rewarding. You start out by saying that, you're not a physician, you're not in, EMT, you're not in the clinical space, but yet you take the time to learn how to, and when Chandra said this was one of the beneficiaries education sessions she wanted to do, the title of this really resonated, How to Save a Life. and you just, spending these 45 minutes to give us just some tidbits on what we can do is so incredibly important. So, Ms. Roberts, you are special. Thank you so very much for being with us today and being our presenter for the beneficiary education session for the National Health Insurance Authority. It was extremely educational and rewarding, and we're
Thank you
grateful.
so much. I appreciate
Thank you.
exactly what you said. Thank you.
Thank you.
Very
All
welcome.
right. Yes. And so at the National Health Insurance Authority, we want to encourage you to save the date for our upcoming wellness initiatives during the month of March. On March 19th, we will continue with our monthly complimentary workout community fitness session, which is also open to families. And so we encourage you to bring a family member or friend to join in the Power Hour workout with us. The date is Thursday, March 19th. And so follow us on our social media pages. Look out for your emails for those of you that are beneficiaries to get more information on our Power Hour for the month of March. We also want you to stay tuned for our farmers market, which will also be hosted on March 27th, Friday, March 27th. And then we also want you to stay tuned for the March installment of the beneficiary educational session. That also would be revealed and released to you via email and on our social media pages. Should you need to contact us if you have any queries or concerns about as it relates to your NHI current enrollment as a beneficiary, whether you wish to be reassigned to your doctor, you don't remember who your doctor may be, feel free to email us at info@nhibahamas.gov.bs. You can give us a call at 396-8500. You're also welcome to visit us at our office. We are located on East Street and Purpose Way. Feel free to follow us on social media, Facebook, Instagram, LinkedIn, and Twitter. Our names on all of those platforms are NHI Bahamas. And then you can also send us a text via WhatsApp at 813-2801. And more information on the program is also posted on our website, www.nhibahamas.gov.bs. Thank you so much, everyone, for taking time out of your day to log on to our call. To be informed, to be educated, and we also encourage you to go to our YouTube channel as well as our Facebook page, rewatch the video, share it with your family members and friends so that we can all play our part in helping to save a life. Have a wonderful day, everyone. Thank you.